Welcome to our discussion on performance improvement in a clinical setting. Topics like patient flow, communication, satisfaction, efficiency, and productivity will be highlighted today.
Hello, I'm Ana Gloria McCormick.
And I'm Vinuraj. Ana Gloria is a lean healthcare consultant and specializes in performance and clinical quality improvement. She works with medical teams in both the clinical and hospital settings, focusing on quality patient care.
Vino is a physician who focuses on healthcare coordination and quality improvement. He works as a clinical quality improvement advisor with medical practices and has a background in lean healthcare.
Performance improvement and why it matters.
Performance improvement is not a one-time activity. It's important to understand your organization's culture and your priorities that align with your mission. This will lend itself towards sustained, ongoing improvement in the future. True performance improvement functions much like this Formula One team example. Everyone knows their role, the work that is required of them, and how important effective communication truly is. The end result? A completed mission. Speed may seem like the overall target, but effectively getting the wheels on for the safety of the driver and for the safety of other racers is just as important. A car is clearly not a human, but similar processes occur each day when providing healthcare. Every staff member must know their job, communicate effectively, have the appropriate skill set, work in unison, and always remember to do no harm when it comes to patient care. Everyone has a role, a function, and a duty to their patient and to their team, just like the Formula One team members.
Continuing on, we are going to review a few tools utilized in performance improvement activities. Let's start with, what is a process map?
So when trying to understand how processes work in your healthcare organization, many tools are available for you and your team to learn how and why things work the way they do. Maybe you're trying to reduce the wait time of your patients. Maybe you're trying to increase the use of your healthcare record in real time. Maybe you're trying to reduce inappropriate ordering of clinical supplies to help your budget. Process mapping is a workflow diagram that is created with the purpose of understanding a process.
All of these questions and many more can be assessed when working towards the goal of overall improvement. Take this process map, for example. The symbols are representative of steps within the process and are useful because they help simplify the areas where confusion can occur. Process maps also help with visually identifying the scope of your project for improvement. This allows you and your team to openly communicate about opportunities for the team to work together.
What happens when your organization really doesn't know why certain issues continue to arise in your daily work?
In these instances, we can use a Murphy's analysis or a fishbone diagram to conduct a root cause analysis. These tools can be very beneficial when data is not readily available to review. Understanding why there is an issue and what causes it to occur can help to identify what resources are needed for improvement.
A fishbone diagram or Murphy's analysis aids in gaining a clearer picture of what causes these issues in your day-to-day activities.
A Murphy's analysis is used to categorize issues by finding overarching themes. It is another tool to help find the root of the issue you and your team may be experiencing. Communication may need to be strengthened between different departments. Providers and staff may feel burned out or dissatisfied with their daily workload. Patients may need better educational materials to understand their medical treatment as takeaways post-visit. Or perhaps your technology needs to be upgraded to a system that functions better for your practice needs. Understanding the reasoning behind an issue can help open up a whole world of possible solutions. Many times observing the environment will help in identifying these categories for improvement.
Let's go for a walk. A Gemba walk.
It is important as a clinician to see and observe the work in your practice as it is occurring. Who does the work? When does the work occur? Why do people do the work this way? Always remember to go see, ask why, and show respect.
Hey Vino, we forgot about waste.
Categories of waste? And who is Tim Woods?
Tim Woods is an acronym for the types of waste that may exist in your practice.
Transportation, inventory, motion, waiting, overprocessing, overproduction, defect, and skills. Being able to identify these different types of waste in your practice are helpful when working towards more efficient productivity.
An action plan is a good tool that's necessary to identify your performance improvement goals. It describes that goal, delegates who's responsible for the work, and documents milestones and completion timelines. An action plan serves as a good roadmap to your destination in performance improvements.
So what is all of this discussion around performance improvement really going to accomplish?
Let's take this video as an example. You have to identify what your performance improvement goal is and who is going to help you accomplish this goal. Communication is key throughout the process. You must identify resource constraints, like a broken light bulb. Remember, you need to be flexible because there will always be changes and barriers along the way. But in the end, you can accomplish your performance improvement goals.
Thank you for spending time with us today. We really enjoyed making this video. This discussion was just the tip of the performance improvement iceberg. However, performance improvement is attainable in the clinical setting. These are not cookie-cutter solutions for your practice. These are applications to help you begin the conversation around performance improvement depending on your clinical priorities. We did not show all of the tools related to performance improvement today, and the involvement of providers and their clinical staff is imperative for improvement to occur. We wish you all the best in your performance improvement journey. You can review these resources or contact us through email.